Initially, at one stage in my life, I would have thought, oh, I'd never let mum and dad go into an aged care facility. Then I'd look after them somehow or other. And I think that's fine up to a point. But when they get to a point, when mum got to a point where she couldn't wash herself or couldn't move around by herself, it became very apparent that we were underqualified. It came to a point in our family where we realised that we couldn't provide the kind of care that mum needed with her Alzheimer's condition. We needed people with experience in dealing with people with Alzheimer's around her. I mean, there were a lot of things she couldn't communicate to us, and we couldn't necessarily read without some sort of professional understanding. The important thing for me in my relationship with mum now is to make sure she has the right care. People around her who understand the disease, who are trained medical people, nurses, doctors, whatever carers, who can be there for her. It's such a relief for us to know that there are facilities for this sort of thing, because it would mean giving up all of our lives, in a way, to care for mum. We love mum, but at the same time, we just can't afford to stop doing what we do. It's imperative to us that we know that she's getting all the kinds of medical care and the facilities that are available in some care centres. I'm just very grateful it's there. I don't know what you would do if there were no facilities available to you, because it's such a full-time thing.